Hey gang, Mark Sweeney here from Austin, Texas at Austin Dental Spa, as you see behind me. If you've tuned in before, then you know what this is all about. We call it Wisdom Wednesday. Every Wednesday about this time for the last 7 years or so, we have brought you the latest, greatest research and health tips that we can find. We've scooped the national news on several occasions with coming out with something that didn't hit the national news circuit for another week or so. Today is going to be no different. This is hot off the presses stuff about anti-cancer drugs, 2 different ones that are already FDA approved for use in cancer patients, but have been found to extend life, possibly. I like it when my studies are done in the United States, but this one happens to be from Germany. We'll get to that in a second, but first, it's a new month. So I introduce a theme every month, and we just got done with May. This was our first episode in June, and our theme for the month is June Jams. And we're jamming by Bob Marley, all queued up on my phone, and then walked out of my office and left it in my office. So you'll get Bob Marley to start Wisdom Wednesday next week, and it'll be fun. But we're jamming in the month of June. So it's June Jams. We're going to show you ways that you can be jamming as we move into summertime and get in tune with your body and with the world around us. So let's get back to these 2 cancer drugs. I'll try to say their name. Rapamycin and trametinib. They're 2 well-known drugs in the cancer industry, but these scientists at the Max Planck Institute in Germany did studies on mice. Now, we've mentioned mice on numerous occasions in past Wisdom Wednesdays. I don't know exactly what the similarities are. That's out of my field of expertise, but there are some similarities in mice in their circulatory systems, so they can test potential fixes for coronary artery disease, and their brains apparently work fairly similar to humans. And so there is a lot of correlation between studies that are done on mice and studies, and will it work the same on humans? This is so new, there has not been a human trial yet on this, but these 2 anti-cancer drugs, these scientists in Germany found that an average mice lives like a mouse lives a year and a half to 3 years. So what they found on these, they started this study with fruit flies. Why they picked fruit flies, I don't know, because fruit flies only live 40 to 50 days, like 2 months. But they started it on fruit flies, and they found that when they gave these fruit flies either one of these 2 drugs, they lived longer. They lived like up to 30% longer. So then they moved the study to mice, and they found the exact same thing, that each drug they gave, they had a control group that didn't get anything. I don't think mice understand the concept of placebos, so they just let 1/3 of the mice alone. The others, they had 3 different groups. They gave one of the drugs to one group, they gave the other drug to the other group, and then they gave a combination of the 2 drugs to yet a 3rd group. So the rapamycin alone in that group, 17 to 18% life expectancy increase, accounting for all other factors. The trametinib, 25 to 30%, 7 to 16% increase. It was a little lower than the rapamycin. But when they did the combination of the 2 together, 28 to 35% longer life expectancy in these mice. Now, they only lived 3 years, but that's almost a whole nother year that they lived with this. Not only that, which is enough by itself, this combination treatment, definitely something I'm going to be tracking for the future. But not only did they find that they lived longer, But this combo treatment of the two drugs delayed liver and spleen tumors in the mice. It reduced age-related inflammation on the brain, and the animals seemed to be more active all the way through their lives than slowing down as they got older. Now, if you can get any one of those three things, and especially all those three things, to happen in an adult, and virtually no side effects with these drugs either. So how does that correlate to humans? Well, we're going to find out, because it's just a matter of time before they start experimenting with these two drugs that have been used on humans for anti-cancer treatments, as how they're going to be utilized for possible anti-aging. But the promise looks great. So you heard it here first. And we always give a health tip of the week. Here's my health tip. This is an easy one because I mentioned Bob Marley. I won't forget my phone next Wednesday. But there was a study published in 2022 in the Harvard Medical School Journal. Harvard's getting a tough time these days, but this was done 2022, 3 years ago, and Harvard Medical School studied how musical interactions or interventions, they found two different ones, active and receptive. Active musical intervention or experiences, like you're actually playing the instrument or you're singing in the shower or something, you're actively involved. Passive or receptive music experience is when you're just sitting and listening to music, or you're driving to work and you're listening to music. But they found that either one of those, the therapies were shown to be effective in reducing anxiety, shifting mood, decreasing pain perception, which is a big one there. We have patients that put on headphones and I can hear they've got the volume turned up so loud, but they are typically much calmer when they're listening to music, especially if they got to pick the music. So it can be a good tool for easing transition into sleep, can motivate people to exercise. I see a lot of people at the gym with their headphones on. Aid in self-expression through singing in the shower, like I mentioned earlier. And it can connect people, like Austin, supposed live music capital of the world. I go to a lot of concerts, and you just feel a connection with it. Every audience seems to have their own vibe. So get out there and listen to some music. Put on something fun tonight that you enjoy listening to, and see if it doesn't help smooth your mood out. I'll see you next week for another episode of Wisdom Wednesday.